Welcome to another live session with me, Vinod James. Welcome to Neetu's Academy, Reading Live. So hope you're all having a great time, really eager, as always, very much on the aspect of enthusiastic enough to, what can you say, study and all those. So it's always like that. We always believe that you're all the most aspiring students that anybody could get, because we're all there making sure that everything is done and dusted. As what you have been told, ready, practicing, everything is there with you. So good enough. So happy to have all of you with us. Excellent. Now, what are you all up to? Tell me, what are the things that you're all there? Are you all studying? Yes, all of you are studying well. I'm sure that all of you are. Good enough, good enough. Uttam Kumar, good afternoon. Softi, good evening. Nice as students are getting into the live. Okay, what are things that you have or Neetu's Academy offers for you? We offer a lot of linguistic exams, training, regular crash courses, you name it, we have it. So if you want to get more professional approach, you're always welcome to contact the number which is there on the screen. We'll be happy to assist you. Because, see, why I keep on telling that is, see, there are certain exams, okay? I'm not able to tell you because there are certain exams which can be beneficial. If you're really aspiring to go for certain countries, okay, there are certain exams which you can be of much more better or benefit. Okay, it's not just that one exam is only available. There are n number of exams that is available depending on the country that you are trying to go. So if you want to get such kind of insights, please do not hesitate to contact those numbers and they will be happy to assist you. Anne Maria Joseph, good afternoon. Nancy, good afternoon. Abia, good afternoon. Gigi Rajesh, hi. Right, and I come every day, Monday to Friday, in front of you, the very same page, the very same time, with reading. Atira Sally, good afternoon. Neetu Madam comes in front of you with every first and the third Friday with her self-prepared writing depiction. And we have other exam live that we conduct. So if you are an aspirant to look into the other exams as well, you're always welcome. Shine Johnson, good afternoon. Chinju M. John, good afternoon. Kavita Balaji, good afternoon. Saki Farooq, good afternoon. If you've not yet joined our social media, we have a number of channels available. We have 2 Telegram pages. If you have not yet liked our page, please do subscribe. Please do join our community, because when you join, our community keeps on growing. And that's the only thing that we all want to, because we join, we grow as a community. Okay, so if you have not yet liked our page, please do like. If you have not yet followed our post, please do follow. If you have not yet subscribed to our channel, please do subscribe. If you have not yet joined our Telegram pages and all, please do. Jaya Arjunan, good afternoon. Soni Raju, good afternoon. Sanita Sabu, good afternoon. Suja Santosh, good afternoon. A very, very, very good afternoon to all my lovely students. Clarina Fernandez, good afternoon. So as I can see, there are lots of at least one icon next to your name, which shows that you're all there supporting us. Whatever that we are doing for you, you're all happy with that. Anita Prabhu, good afternoon. So if you feel that whatever that we're doing is beneficial, please do not hesitate to share the very same page that you're watching on your social media platform. Why? Because there are a number of students who are still unaware that we are doing such kind of free classes. So no matter wherever, whichever part of the world they are, they can also be of benefit, isn't it? Our job to come in front of you like this is to make sure that we have that impact across the globe on the aspect of making them also reach their dream country. Monica Vegas, good afternoon. Excellent. So a lot of no names today. But still, is there anyone who is attending the live for the very first time? Manganaringlod, Subiraj, good afternoon. They might live attending Naringlod. Anybody like that? Yes, who's attending the live for the very first time? No, okay. All of you were here with us, isn't it? So fair enough. Chinju and John. Yes, is it Chinju? Are you attending for the first time? If so, please do let me know where you're from. I'm Suja George. I'm attending online for the first time. Thank you very much, Suja, for letting us know that you're attending for the first time. May I know where you're from? Not for any reason. I love to say that I have known people across the globe. That's all. Akila Sham, good afternoon. Nice. So I think Suja was the first person to say. I think Chinju was also in Kodamangalam. Okay, nice. Good, good, good. Srimal Mohan, Reddy. Okay, good enough. Excellent. So Chinju from Kodamangalam, Suja attending for the first time. I'm from Kotarakara. Okay, currently in Abu Dhabi. I have a lot of students from Abu Dhabi as well. So this is the beauty out of it, because no matter whatever that you are, or wherever that you are from, okay, you're attending an international class. Why? We have people from different parts of the world. Seema Castellino, first time. Thank you. Gigi Rajesh, I'm not preparing, but here to listen. You looks interesting. Thank you very much, Gigi. Very kind of you, because that's called the power of learning, isn't it? You're enthusiastic enough to see something which is happening. That's an absolute way to go. Congratulations on your positivity that you're bringing onto yourself. Good. Seema Castellino, may I know where you're from? Princey Jomon, good afternoon. Excellent. So you can see we have people from different parts of India, of course. We have people from Nepal, we have people from Maldives, we have people from Mauritius, we have people from Malta, Sri Lanka, Pakistan, Afghanistan, Israel, different parts of United Arab Emirates. We have people from uh, what do you call it? Australia, New Zealand. We have people from Italy. We have people from UK. We have people from Ireland, US, Canada. You name. We have people from different parts of Africa. That's how. Seema, I'm from Karnataka, working in Kuwait. Thank you, Seema. I have a lot of students from Karnataka as well, because Bangalore, I have people from Bangalore, Belgaum, lots of places. So yeah, happy. Princey Joman, good afternoon. Geetu Soni, good afternoon. Pratisha Kannat, Kannat, good afternoon. So are you all ready for today's session? If so, give me a quick thumbs up. I'm so happy because there are 3 people. One from Kodamangalam, one from Karnataka, and another from Kotarakara, from, of course, you are from Abu Dhabi, and the other one from Kuwait. Good. And I have Gigi, who's here for just to experience that. So that's how it is, isn't it? So happy. Rasna, good afternoon. So are you all ready for today's session? Limi Lewis, good afternoon. Jaya Arjunan, ready. Ashwita, Bangalore, ready. Monica Vegas, ready. Softy, ready. Akila Sham, ready. Abia, ready. Good enough, good enough. So as you can see, Neetu Madam will be coming few days of time in front of you with her self-prepared writing case note. So please do keep a reminder, and we'll all be waiting for you there. Merin Thomas, good afternoon. Geetu Soni, yes. Kavita Balaji, yes, ready. Kalamani, good afternoon. Sonia, ready. Thansi, ready. All right, Renita Joan, ready. So as what you have all said ready, we're going to do part B. The part B, the question will be shared on the screen. You are expected to do it with beating the time. Anne Maria ready. Subiraj ready. So do not waste your valuable time. Do find an answer. Once you find an answer, Tina Antoni, good afternoon. Do not type the answers. I'll ask you when to type. Just put a thumbs up or say done. There you have the material on the screen. Please do the material and then we will discuss. All right, time have just gone, but I'm so happy that all of you, I would say most of you, have started saying done, 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 done. Right? The first one to say thing, Antoni done, Pratisha done, Tansy done, Saki done, Sony done, Shine done, Softy done, Monica done, Kavita done, Tripti done, Anita done, Kalamani done, Jaya Arjunan done, Tangasudha done, Abhiya done. Good. So as you have all said, done, Tintu Srijit done. So happy that you're all saying done, because even that done has a great significance in your what do you call it, evolution on the aspect of from where you are to where you want to be. Okay, good enough. Chinusri done, Sonia done, Subiraj is saying C, Ashwita done, Jinju done, Kodamangal, Limi done, Anne Maria C, Sonia Beeman C, Geetu Soni done. I have Tripti saying A, so I have two answers, A and Monica Vegas B from the first sentence. Okay, now I have A, B, and C. Am I happy? Suja done, Rasna done. So I have A, B, and C for what I have. Now, would you be kind enough to tell me what are your answers and where you got the answer from? That where is very important. Not just the answer, where you got the answer. Because we always believe in correcting from where you went. If it is right, be happy. If not, no problem. B from first sentence, Pratisha B, Softy C, Tansy B, Renita C, Limmy B, Shine Johnson B, Ashwita B from first sentence, Anita B from whole, Chinantoni B, Subiraj C from the whole para, Gitu Soni, went to Vapi forgot option. Okay, fair enough. Rashna Suraj C, Abhiya C from whole para, Akila B whole para, Pratisha C from whole para. So C, B, all of you are saying it is from the whole para. Fair enough. Jaya Arjunan B, Geetu Soni from whole para. Good. Sonia Beeman from whole para. Kalamani Shankar B. Quite good enough. Okay. Now anybody else want to comment? You do not worry about whether it is B or C. Then to where? Okay. Tintu Srijit B, Tangasudha B. See, don't think that all the students are saying something, so that should be the answer. No, there are n number of times where none of the students have got it right. There are students where only one student got it right, minority have got it right, 50-50 have got it right, majority have got it right. So there is no hard and fast rule saying that, okay, whatever the students are saying is always right. You say what you have got. That's called learning. Moby PKB, Anne Maria C, Shiny, done. Okay, fair enough. Now let's go and see, because I think most of you have told the answers. Now let's go and see what are the things that you have to be looking into when you're doing part B. See, first and the foremost important thing is to have a right strategy. So what is the strategy to do part B? See, the strategy to do part B is called elimination method. Uttam Kumar B, fair enough. Kavita B. Now what is the thing called elimination? So elimination means you're literally going to read and then eliminate the option if it is as such mentioned, put it, keep it there. If it is not mentioned, opposite, eliminate it. If it's not saying anything contradictory, eliminate it. If it's not at all mentioned, eliminate it. Now, and then the most important thing is about three things that you have to do in part B. Read the question. As you are reading the question, underline the keywords in the question, understand the question. Very, very, very important. Okay, and your keyword should be stipulated to at least 2 to 3 words only, not about underlines. Okay, that's not keyword. Words that will, see, those keywords are the words that will trigger you to understand or remember what the question is asking you for. Those are called keywords. Now see, this memo is providing information. So memo, information, those are the only 2 words that I need. Okay, then I'm going to read my answer option, because there are 2 ways after that. You can read the answer option, then pick an answer, or you can read the paragraph and then pick an answer. Either way is okay. I'm a person who always believe read my answer option, then read the paragraph, because I need to know what I'm searching for in the paragraph. Whichever you are, do stick to it. Now, first option, who, where. Okay, or second option, when. Third option, why. So who, where, when, WH. Okay, everything has its own meaning. Who means are. When means epol. Y means ended. These are the three answer options that is there. So who? The person. When means that particular period. Why? The reason. That's how you differentiate it. Because all the others are clear, isn't it? All the others are of same thing. Where PP, where PP, where PP is always there. Where? Now reading the answer options, the paragraph. Decision making about personal protective equipment, that is PPE. Now I'm reading. PPE is designed and issued for a particular purpose in a protected environment and should not be worn outside the area. So they are saying when. Now let's say, slightly pointing into B now, reading further. Protective clothing provided for staff in areas where there is high risk of contamination, example, operating suite or room, must be removed before leaving the area. Okay, so they're saying, okay, these are the area that is there, so you should wear that there. Then when you are out of that area, it should remove. So again, when. Now, even where there is low risk of contamination, clothing that has been in contact with patient should not be worn outside the patient care area. Again, when. Inappropriate wearing of PPE, wearing outside the operating suite, room attire in the public areas of a hospital or wearing such attires outside the facility may also lead to public perception. Perception means thinking of poor practice within the facility or facility. It's not facility, it should be facility. Okay. Now, let's go to elimination. Who should wear? Anywhere mentioned who should wear? No, they're not saying anything about who should wear. Not mentioned. Why to wear PPE? See, they are saying with the PPE, the risk of contamination is there. That's why it should be removed. No, it's not showing about why to wear. So throughout the paragraph, it is talking about when to wear. See, when you are entering a high-risk contamination area, please do wear. But when you're coming out of it, remove it. Again, even in a lower risk area, when you come in contact with the patient, you should be wearing it. And as soon as you come out, you should be removing it. And after that, they are saying, what is the reason that you have to remove it? Why? Because the people will start perceiving things that, oh, this place is all contaminated. That's why all the people are wearing PPE. Understood? So congratulations for people who have got B. Absolutely right answer. People who have got C, doesn't matter because that small misunderstanding have made that. People who have got A, there's nobody who specified saying that, okay, these are the people who should be wearing it. So good enough, Uttam Kumar, as always, Balde Balde. Is it? Monica dancing, Tina Antoni happy. Good enough, good enough. Anita Prabhu dancing, keep on dancing. I love those students who are there with the purpose of enjoying their achievement. See, the achievements that you get are to enjoy. You should be the first to enjoy your achievement. You should stand by your answer and you should enjoy if it is right. Even if it is wrong, you should enjoy why you've been corrected. That's the power of learning. Anita dancing, Subi clear, Akila Sham dancing, Softy clear, Kavita dancing. Good enough, good enough, good enough. So any doubt with regards to what I've told you? Anything that you want me to clarify? Tansi dancing, Happy. Kavita Balaji dancing, Ashwita dancing. Good enough. 136 second, I got it. Okay, fair enough. Kalamani Shankar, fair enough. 1 minute and 30 seconds is a good time. Rashna Suraj, clear. Excellent. Good enough, good enough. Any doubts? I'm not Anne Maria, sorry. Clear. Jaya Arjunan dancing. Keep on dancing. Good. Ashwita. Sonia Begum, clear. Beeman, clear. Right. So I don't see that you have any. Ashley, clear. Okay, fair enough. You're all saying clear, clear, clear. So what else could I ask for? As long as you are all with no doubts, that's our job, isn't it? To clarify your doubts. Shiny is happy. Renita clear. Now let's go into the next one. What is the next one? Can you tell me what is today's part A and how you felt about today's part A? That how is important for us? Why? Because after seeing your house, Neetu madam will be framing the next day material. So please be kind enough to tell us whatever that you have felt of today's material. Trigger point injections, easy material, Kavita, okay. Softy, easy material, okay. The first few are saying easy, so I'm happy because yesterday you all said tricky, today is easy. So it depends on how you perceive things, isn't it? I always believe when you are exposed to certain kind of, that terminology, you find it a bit more easy, is what I found. It's not that you don't find it easy, but that's that. What you can say is about that attitude towards it. Monica Vegas easy, Jaya Arjunan trigger point injection, Subiraj easy, Renita easy, Abhiya trigger point injection, Aswita easy. Alright, so basically what I understand is an easy material, is it? Fair enough. Anshu Roy, good afternoon, trigger point, easy material, fair enough. So are you all ready for me firing those 20 ounces? Yes. You're all ready? Yes, if so, give me a thumbs up. How many of you are eagerly waiting to see the answers and tick, 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 tick and say 20 out of 20? So because it's easy, how many of you say that you will get 20 out of 20? Geetu Soni, material. Softy, yes. Ready. Ashwita, yes, ready. Subiraj, yes. Ashley Jose, ready. Tintu, ready. Ansu, ready. Abhiya, ready. Shine, ready. Okay, fair enough, fair enough. Akila Sham, ready. Easy. Pratisha, trigger point. Sonia, Linita, yes. Alright, as you've all ready and eagerly waiting, I'm not going to keep you waiting. The material will be popping up on the screen, and as soon as the material pops up, we'll be discussing part A. So I hope all of you have taken the printout as well. Selva, good afternoon. Sorry for the delay. Do not worry, Selva. I know that you're all busy with your work. Sonia ready. Suja ready. Now, what are the things that you have to be very much sure about? See, part A is the first material that comes in front of you. They'll only give you part A, and then you have to do part A in 15 minutes. You're expected to tackle 20 questions. Okay. So 20 questions, there are 3 types. What is the strategy? The strategy of part A is called skimming and scanning. Okay, skimming means quick look, scanning means detailed look. That's how it is. Okay. Then, what are the other things that you have to be really looking into? You'll have 4 texts based on one common theme. Okay, and today's common theme is trigger point injections. Okay, after that, each text, how much of a time that you are able to take for skimming? See, they say 1 to 2 minutes. I say 15 seconds per text is more than enough. So quick look is what you're going to do. So as you skim through, you're going to underline the keywords. Am I clear? So what are the keywords that you're going to underline? So keywords are words, okay? See, please understand, don't write big underlined sentences, okay? Keywords are words. Now see, I'm just going to show you. Trigger points are focal areas. So focal areas of spasm, inflammation in the skeletal muscle, the rhomboid, trapeze back muscle located in the upper back and behind the shoulder area, common site of trigger point. Trigger points on those in neck pain, shoulder pain, headache, and in addition to that, severe spine. Can also in lower back, lessly common extremities on the palpable nodule, located and the area is tender and frequently pushed when pain radiates. Trigger point itself around the trigger point are commonly accompanied with chronic musculoskeletal and fibromyalgia from myofascial. Neck pain, low back pain, and the occurs tension headache, temporomandibular pain, acute trauma, repetitive minor injury, and development of trigger. A trigger point involves in the medical directory trigger point. I've done that. Now I know that these are the area, these are the causes, this is where you're going to get in text A. After that, trigger point infection is performed. So something that is performed, that means it is undergone or something like that. So again, performing, these are the areas. So they are saying lying and sitting, and the exact techniques vary. The health professional performing procedure locates the manual palpation and mark the site, ultrasound guidance. It's not necessary. The injection site is cleaned, alcohol, and then betadine is used, and frequently a numbing spray, ethyl chloride, anesthetize the skin, and the needle is inserted in the medication. Likewise, see, they're talking about acetaminophen, over-the-counter NSAIDs, all those things, ibuprofen, naltrexone, all those things are mentioned. So after that, go to C. Trigger point injection can cause various immediate and long-term side effects. So these are the side effects. So all those things are mentioned in C. And now to D, we're talking about study, inclusion criteria, exclusion criteria, baseline screening, numbers, trial group, control group, assessment 4 weeks, assessment at 4 weeks. So all those things. After this, you're going to go to the question. So as I mentioned, these 20 questions are divided into 3 types of question. So question number 1 to 7, the first set of questions are called match the following question, where the instruction clearly says you are expected to write any of these letters, A, B, C, D. And they're clearly saying you may use any of these letters more than one because, of course, 4 letters, 7 questions. So obviously understood. Now here also strategy, keyword, because part A is purely keyword reference, not about understanding, not about inference and all. You just refer the keywords and scan that area. That's called skimming and scanning. Now I'll show you why. Recovery duration of the complication associated with anesthesia-based trigger. So where are they talking about anesthesia-based trigger and all? It should be definitely in C, isn't it? Because side effects. So anesthetic based is there. So injection called myonecrosis. So what is the answer? The answer is C. You are not supposed to find where it is. Just the text. Just write C. Next, how many patients? 4th week. Do you really need a second thought? It's clearly saying how many patients. 2nd week. Go. It is there in D. Why? Isn't it there? It is there. Clearly, everything is as such mentioned in D. Okay, and then assessment 4th week, everything there. Now, let's say the next question. So what are the determinants lead to development? So what are the factors? So factors are all mentioned in A. So the answer to that question is A. Understood how you're gonna refer? It's absolutely like that. Now, factors that render someone to be ineligible for receiving trigger, ineligible, exclusion criteria. So likewise, 4th week is mentioned, likewise exclusion criteria. So the answer is D. So what impact does a trigger point have on lungs? So something it's talking about. Again, it should be the complication, isn't it? Where are they talking about things that happens in the lungs? It says in the lungs, isn't it? Where? Sorry. So it causes one or both lungs to collapse. So the answer is C. Now see, what are the customary locations of trigger points? So customary location. So what are they talking about? Usual location is what paraphrased is. So the trigger points is located in the neck, shoulder, headache, and all those pain. So that's where the answer is. The upper back, behind the shoulder, common side trigger point. That here is the answer. So the answer is A. Medications employed, post-relief trigger. So medications, where are they talking about all these medications? There's only one place where they talk about medication, isn't it? It should be in B. Why? NSAIDs and all those medications are mentioned. So this is how you refer with keywords. So I have finished 1 to 7. Now the next set of questions. The next set of questions are called short answer questions, where it starts from 8 to 14. Now instructions are, it can be a word, number or numbers, both word and a number, or a short phrase. Short phrase should be anything between 2 to 3 words. Lot of 7 out of 7. Absolutely good enough. Keep it up, keep it up. Good, good, good. Now again, even though the type of question changes, strategy doesn't change. Okay. So as you can see, Ansu 7, Tintu, Anita, Shiona, all 7, Renita 6, Softy, Akila, Gavita, Pratisha, Shine 7, Ansu 6, Ashwita 7, Anne Maria 5, Kalamani 6. Good. Now, go and underline the keyword as well. So, who underwent SWE with blind injection in the study group? So, study group go to, now who underwent? So, SWE guided blind injection. Who underwent? So, control group. So, the answer is a two-word answer. Alfina 7, Uttam Kumar 7, Jaya 6, Geetu 6. Very good. Chinese 7. Excellent. Keep it up. So the answer is control group. Two-word answer. CONTROLGROUP. Now the next question. An acute form of muscle damage due to the involvement of anesthesia. There is an acute form. What is the problem? Myonecrosis, anesthesia, all those severe, acute. MYONECROSIS is the answer. Now, an alternative to alcohol employed to clean the injection site. I know where I went because I have underlined it also. So what am I saying? See, the injection site is cleaned by alcohol and another clean cleanser. Use betadine. BETADINE is the answer. So BETADINE. Question 11. What are various positions for delivering trigger point injection? Position, that means you should be doing somewhere. So where are they talking about the position? Yes, go to B again. Why? Usually the patient will be either lying, lying, on the exam table on the stomach or sitting on the exam table. So the answer is lying or sitting. So what are the positions that you do? Lying or sitting. Clear? Anne Maria Joseph, don't write this betadine bracket text B and all, okay? If you practice like that, you are going to use it on the day of exam also. That is going to cause you not get the mark. So do not write anything else other than what is your answer. Don't write this text B, I got text C, I got text D. If it is for me, no problem, but don't. I would advise you not to write that. Because whatever that we are doing it to make sure that you are getting benefited out of it. Yeah? Lying or sitting. Absolutely good enough. Now, what gets deposited between the chest wall and lungs, resulting in partial or incomplete lung collapse? So again, lung collapse, where are they talking about? It is there in C. Why? The air or gas accumulating in the space between chest and wall can cause one or both lungs. So partial, one, complete, both. So the answer is air or gas. AIR or GAS. Now, which is the numbing spray utilized to anesthetize the skin to minimize discomfort during injection? So again, some complication, isn't it? So what are they going to use? They're going to use frequently a numbing spray such as ethyl chloride. ETHYLCHLORIDE is the answer. The possible age bracket means starting and end. For individual included in the study group go. What is the individual? 40 to 49 years. A very straight answer. Good enough. Now the next set of questions. The next set of questions are called fill in the blanks. Question instruction remain the same as what you did in short answer. Word, number or numbers, both short phrase. Strategy not going to change. But here you have to be very cautious of redundancy. That means even an article, if you write again, if it is mentioned in the question. See, 40 to 49 years is the most appropriate answer. 42. Just copy how it is given in the text. Yeah. Right. Injection pain, swelling and dash typically diminish within hours. Persistent side effect after 2 weeks should prompt contacting for help. So where are they talking about all these keywords? These keywords are all there in C, isn't it? Pain, swelling. So what is the only thing which is missing? Tenderness. TENDERNESS near the injection site, usually for hours, and side effect does not resolve for weeks. You should contact for the doctor. That is for help. That's how you get that answer. Excellent. Trigger points often coexist with chronic musculoskeletal disorders such as fibromyalgia, Now what is the next one? So fibromyalgia, where did you underline that? Easy, isn't it? Go to A. Fibromyalgia is there. So myofascial pain syndrome. Do you need to write pain as the next question? You have to. Why? Because pain is not given in the text. So the answer is a 3-word answer. Myofascial, MYOFASCIAL is the answer. Candidates with dash leading to muscle spasticity are not included in the study. So not included, go to D. Now go and see where is muscle spasticity and all mentioned. So it is there. Why spasticity, morbid muscle? So who is having cerebrovascular disorders? CEREBROVASCULAR is the answer. Good enough. Now question 18. Dash helps mitigate. Mitigate means is a very beautiful word. It's called lessen. Okay. Mitigate the risk of serious complication from trigger point injection. So where are they talking about lessen and all those things? So definitely it should be there in C again. So ultrasound imaging can help minimize, mitigate the risk of developing. So what is the answer? Ultrasound imaging. ULTRASOUND is a one word. Imaging, IMAGING is the answer. Now the penultimate question. Common trigger points are found in rhomboid and dash in the upper back behind shoulders. So definitely in A, isn't it? So rhomboid and trapezius muscle. So the other keywords are as such mentioned, isn't it? In the upper back is already mentioned. So you are only expected to write trapezius muscles in the upper back. So that is understood. So 2-word answer should be written trapezius, TRAPEZIUS MUSCLLES. Good enough. Now the ultimate question for today. If there's a pain at the injection site post-procedure, OTC is over-the-counter, non-steroidal anti-inflammatory medication, NSAIDs, such as DASH or ibuprofen can be utilized. So what is the next thing? Where are they talking about? It's a very straight answer when you go and look into in B, because it clearly says naproxen sodium, NAPROXEN So I have fired my 20 answers. Now, is there any doubts with regards to whatever I have told you? If so, please do clarify. If not, do shoot me your scores. What are your total scores? Or if you have any doubts with regards to any of those questions, you're always welcome to clarify. Any doubts? Subiraj 19, absolutely good enough. Tintu 20 out of 20, absolutely good enough. Excellent. Uttam Kumar 20, 13 minutes, absolutely good enough. Anita 20, Shiona 20, Kavita 20, Ansu 18, Akila 19, Alfina 20, Shine 20, Ashwita 19, Ansu 20, Softy 20, Jaya 18, Kalamani 18, Anne Marie 18. Absolutely hats off to each one of you for those great achievement that you've done. Anne Maria 19, Suja 16, good enough. Anne Maria 18, fair enough. See, we're all here to learn. Do not worry about what others have got. You have to be proud enough of what you have got. That's called learning. Manjula 18, absolutely good. Right. So I think all of you have told me your answers. Not all, but I know whoever have told me, good enough. Now, is there any doubts with regards to any of those questions? Anything that you are not sure about, anything that you want me to clarify? Shiny 17, good enough. Anita, thank you. Okay, that you have started saying thank you. So I think you don't have any doubts. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.